Progressing on down the form, Code 8A, training for non-Medicaid related services such as improving delivery and referral to non-Medicaid services like IDA and Child Find. Again, if you're doing those activities, please record them. No narrative description is required. Moving to Code 8B. Improving delivery and referral to Medicaid-related services, early identification and referral for special health services like EPSDT and other early childhood medical services. Staff need to understand about the medical services. Again, we'll refer to the Quick Start Guide. What is Medicaid? All of those medical services under the Medicaid umbrella, doctor visits, dental care, checkups, counseling, eyeglasses, hearing aids. All of those services are important for staff to understand and to know how to access so they can move on with that information to parents. The proper narrative description for this, when staff have been trained, is train staff with Medicaid information. Also notice under Code 8B, it talks about training staff on how to fill out the time study sheet. This should be listed under Code 10, not under 8B. When you train staff how to fill out the time study form, note that the time should be a minimum of 7.5 minutes, 7.5 consecutive minutes to qualify for the tick mark, and it is okay or appropriate to use the Quick Start Guide for the training material. But again, it must last at least 7.5 minutes to qualify for the tick mark under Code 10. Moving down the form to the 9A, 9B section, referral monitoring of Medicaid services. Under Code 9A, we have referrals for non-medical services or state education agency mandated child health screens. This is when you have your school nurse is providing vision screenings, they're doing hearing tests on numbers of students, providing scoliosis screenings for students. This would also be when the counselors or health nurses might be providing additional information on items like the food bank or WIC programs. And again, because they are an A activity, a narrative description is not required. Now, the 9B activity is really a big category and is going to take a little more explaining because it includes activities not described on the time study sheet. Under Code 9B, referrals, coordination, monitoring of Medicaid services such as medical, dental, mental health, substance abuse, and family planning services. Use this code when making referrals for coordinating and or monitoring the delivery of medical services. Let me give you an example of a 9B scenario that teachers and staff might encounter. A staff member has a medical concern regarding a student. So you go to check the student's file to see if there's anything in there regarding any medications or any other medical conditions. Doing this is a 9B activity that would be documented as collecting data regarding a medical concern. Now, you may or may not find something in the files, but you have this concern about the student. So you go talk with other teachers, counselors, health nurses, other staff members, administrators. You're still in the process of collecting data regarding a medical concern or conferencing regarding a medical concern. You have staff meetings, you have MDT meetings, small group meetings, team meetings regarding students with medical conditions or medical situations. So another narrative description for a 9B would meeting regarding a medical concern. At some point, you've collected the data and you do have this concern, so now you talk with a parent. You either make the phone call with a parent or they come in for a session with you. So that would be parent contact regarding a medical concern or a parent meeting regarding a medical concern. Now, also understand that you can spend this time talking with students, especially junior high, high school students, older students, some who are homeless, or we have a lot of students who don't have much parental support these days. So as your older students, junior high, senior high, when you're working with students who are taking care of their own medical business, it does not have to be a parent contact. Keep that in mind. So a student contact regarding a medical concern, student meeting regarding a medical concern. And from that, once you have those connections made, you've done the conferencing, you collected data, you had the contact with the student and the parent, that's most likely going to lead you back up to that 1B activity that I mentioned about recommending medical access providing the Medicaid insurance form, and or down to the 2B where you assisted them in filling out the form. A couple of more narratives that can be used in the 9B area. A very important one is follow-up contact regarding a medical concern. To make sure that kids don't fall through the cracks, we meet with a parent or student a week or 2 weeks previously. We may have recommended medical access, but we've not heard back from them regarding a doctor's appointment or maybe some follow-up information regarding some medications. So on a time study day, if you contact the parent or the student, say something to the effect, hey, a couple weeks ago we talked about Johnny or Sally seeing the doctor, etc., etc. How's that working out? I haven't heard back. This is very important. Record that under 9B, and the correct narrative would be follow-up contact regarding a medical concern. Another commonly used 9B activity would be when you're working with a parent or a student and you assist them in making a health referral, helping set up the appointment, doing whatever it takes for them to get their health services. So the correct narrative there is student referral for medical services. So in those 9B activities, once you've collected the data, you've had meetings, you've had parent contact, student contact, and you know that there's a possible medical issue, then this is where you take these activities that lead up to that conversation you had in the 1B with the parent or the student where you recommend medical access. So we covered that. And or at that point you might provide them the Medicaid insurance information, which may also lead you down to that 2B where you assist them in filling out the Medicaid form. Also included under 9B would be the related paperwork, clerical activities, or staff travel necessary to perform these activities. That pretty well covers the A and the B activities. Now, the scenarios I've given you and the narratives I've given you are not the only narratives that you can use. They're probably the ones that you will be using the most. Please check the Quick Start Guide. We have narratives listed in there that go for other activities and other things that you might be doing. And it's always good to review the Quick Start Guide just to see if there's some other narratives that are more appropriate for the activities that you are doing. At this point, we want to go to Code 10. So we've covered almost all the blanks on here except for Code 10. Now Code 10 has a couple of different areas, so I want to make sure that we cover these, and we'll try to keep them separate so that people understand how it works for them. Code 10 is very important. Now, if you'll notice on the form, it says Code 10, system support or personal time. Staff meetings, breaks, lunch, annual leave, and sick leave, and medical AdMatch time study training. So let's break the Code 10 time down into a couple of different areas. Number one is all elementary staff. You can put down a tick mark for each recess that you have that you are not supervising. These are considered, quote, breaks. So you are not outside supervising the recess. So you can put one tick mark for each recess. Secondary staff, you don't have any recesses, you don't have any breaks. They do not allow your planning time in this time, so you're not going to have any in there. Now, everybody should have at least one tick mark on a time study day for spending a minimum of 7.5 consecutive minutes reviewing the Quick Start Guide as a training source. We encourage you to review the Quick Start Guide because that'll help you think about some activities that you may have done that you may not have thought about, and that is considered a training also. So everybody should have at least one tick mark for reviewing the Quick Start Guide for a minimum of 7.5 consecutive minutes. Elementary schools with recesses should have one tick mark for each recess. Classified staff, you are not paid for lunch. You don't normally have your recesses. All classified staff should have one tick mark for reviewing the Quick Start Guide for a minimum of 7.5 consecutive minutes. And also one tick mark for each paid break. So if you are a part-time staff member, you're going to have one paid break, which means you would have at least two tick marks, one for your paid break and one for reviewing the Quick Start Guide for a minimum of 7.5 consecutive minutes. And a full-time classified person should have at least 3 tick marks because they're going to have 2 paid breaks and one for reviewing the Quick Start Guide. Now, in addition to this, we have some districts who have paid lunches. We have districts who do not have paid lunches. If you are in a district with a paid lunch, you have that 30-minute lunch. You should be marking 2 tick marks down for your paid lunch. Obviously, if you're in a district that's not paid for lunch, then you're not going to have any lunch times there. Now, under the Code 10, you do not need to have a narrative. You just need to put your tick marks down. If on a time study day you are absent and let's say you have a 7-hour contract, you don't need to put 28 tick marks. You would just put your time in the far right-hand column, 7 hours, and that would show that you are out on sick leave. If you are gone a couple of hours, you leave early to go a medical appointment, or you come late from an appointment, by an hour or 2 hours or something like that, that is paid sick leave. Then you would document your time under Code 10 for those hours that you were paid that you were not at school there. On a time study day, if there is a staff meeting, say a 30-minute staff meeting, everybody would mark an additional 2 tick marks for the staff meeting. If you are a person who takes care of the time study forms, on a time study day, if you're one of those supervisors who disperses, collects, reviews time study forms, you can document your time under Code 10 on those days for doing that also. We have come to the end. We are going to now talk about finishing up on the time study form. Each tick mark represents a 15-minute period of time. A person should do a minimum of 7.5 consecutive minutes to qualify for the 15-minute tick mark. So we're going to transfer the time from the tick marks to the far right-hand column in numerical form. So each tick mark represents a 0.25 period of time. Now on the bottom of your form you had your contracted time, 7 hours, 7.25, 7.5, 8. All of your tick marks and your time under the B's of Code 10, Code 4, Code 3, all of that time is going to equal your contracted time at the bottom of the form. So let's go to the bottom of the time study form. We're going to work our way up as we look at our time. And let's say that we had 2 tick marks under 9B, which equals 0.50 or half hour. Let's say under 2A that we had 1 tick mark, so that's 0.25. Under 1B, let's say that we had 1 tick mark, another 0.25, so that gives us a 1 hour total so far. Let's say that we also had a 0.25 1A. And under Code 10, let's say that we had 3 tick marks, which would equal 0.75. Now, we want to come up with 7.5. We're using a 7.5 hour contract as an example. So moving up the form as we go to Code 4, Code 4 is especially for counselors, health people, nurses, and psychs and therapists who are providing direct medical services for students. This is the appropriate place for them to record the time when they're providing those services. Certificated staff, most staff will not be using that. Now, the last category is Code 3. Now, remember when I introduced the time study form at the beginning, I said Code 3, educational school-related activities. That's how teachers and other staff members, that's your regular assigned duty, teaching, supervision, grading papers, creating tests, those types of things. For most people, this is going to be where the major part of their day is. So when you get to Code 3, that time is the difference between the sum of all the other codes and the total paid time at the bottom of your form. So in this case, we had 2 hours of A, B, and Code 10 time. We need 7.5 hours. So Code 3 is going to be 5.5 or 5.5 hours. That will equal our 7.5 hours. That's great. You sign your name in ink, date it, turn it into your supervisor, and you should be all finished. If you have any questions, please refer to the front page of the Quick Start Guide. You'll see that there is all the contact information there. For JTech, you'll see the contact information for the 3 consultants, Tom Reese, Scott Adolph, or Jack Hedgecock. Feel free to contact any of us for any information so that we can help or assist you in doing a great job and being able to help a lot of kids get medical services and bring some money back into your district. Thank you and have a great day.